For over a decade, health advocates have been trying to push people to become consumers of their own health care, to stop relying on insurance companies and healthcare facilities to take care of things, because we think that's the only option.
But if you take the time to look into what you're buying, you may be surprised at how much you can save. Here's 13 on Your Side health reporter Valerie Lego.
You know the feeling when that medical bill arrives and you wonder, how much is it going to be? You look at the price and reluctantly write the check. Because what else can you do? How about don't pay it?
Never pay the first bill until you have checked that bill to make sure that it's accurate and to make sure that it's priced in a way that's fair to you, not exploitative of you.
Marshall Allen is a healthcare journalist who's dedicated part of his career to helping people get fairly priced medical bills.
So we have to get over the idea that someone else is going to fix this for us, because no one else is going to.
In his book, Never Pay the First Bill and Other Ways to Fight the Healthcare System and Win, he gives easy-to-follow advice on how to make sure you're paying a fair price. Your first step is to ask for an itemized bill.
When you get that itemized bill where it breaks down each of the individual charges, then you can check those prices.
Once you have those prices, you'll want to use the website fairhealthconsumer.org. It's a national nonprofit that checks consumer prices for healthcare using 36 billion claim records from all types of insurance providers, including Medicare and Medicaid. Let's check out the most popular medical procedure in Michigan, the knee replacement. So let me show you how it works. First, you want to check on medical and hospital costs. Then, if you're not sure if you're staying in network or out of network, click Not Sure. You also want to type in your zip code, which can be anywhere in West Michigan. After that, type in knee replacement. It will bring up a large variety of types of knee replacements, but we chose the top one, which is the most popular. Then, get your cost. You'll be able to see here out of network and in network. And as you scroll down, you'll also be able to see the breakout: anesthesia, radiology, pathology, all of the pricing that is fair market value for in-network and out-of-network in our area. And if you want to look a little bit more local, you can also see whether or not there's anybody overcharging or undercharging. In the blue is the same amount that we see in the price chart. The green shows that it is a lower cost. So this is a great way for you to check out your pricing. You can also check now to see whether or not you have been overcharged on your bill.
That would be the kind of bill that you should contest. Other times on the itemized bill, you'll see that they've included charges for things that did not even occur. That's very common. So it is a very complicated system. And on the billing side, it incentivizes overcharging because everything they bill for, they're going to try and get paid for. So you have to check and make sure that the billing codes are accurate and depicting what actually happened.
Then comes the hard part: making that phone call to your provider's billing department and advocating for yourself.
We are giving them the incentive they need to be fair with us, to listen to us, to come back to the table, negotiate a fair price, correct an error in a bill, and then we can all be happy here.
It is within your legal right to negotiate for a lower price if you have the evidence that you are being overcharged. If they're not willing to negotiate, then Allen says take them to small claims court.
And then when you file that case, now that medical provider is accountable in our justice system for the way they're treating patients, and they have to hire an attorney, usually at a cost of hundreds of dollars an hour, to defend this case that might only be worth a few $100s or a few $1,000s. It's not worth their time to continue their abusive practices.
In the end, you have to learn the system and then advocate for yourself, because you are the consumer and you deserve to know the price you're paying for your health care is fair.